If you have been told spine surgery and wondering what your life will be after having surgery, or you are someone who has recently had surgery and have the same question, then we are going to discuss in detail in this video life after spine surgery. Welcome to my channel Zen Spine. My name is Dr. Rakesh Dhake. I'm a fellowship trained spine surgeon certified by the Royal College of Surgeons of England and currently practicing in Mumbai. So I'm assuming here that you have had a good discussion with your spine surgeon and you have made the decision that you are going to go ahead with surgery. You have had the surgery. So we are going to discuss right from the day of surgery until the rest of your life. So on the day you have had surgery, we take it easy. We ask you to rest. There will be two tubes in general coming out of your body. One is going to be a urine catheter if you have had a long surgery. If you had a short surgery like a discectomy, we may or may not put a catheter. Second is a drain that I usually put in my patients. The drain is to remove any extra blood that is collected in the surgical area. So this drain and urine tube is what you may have on the day of surgery. We ask you to rest. You can turn in bed. You can sit if your pain allows you to sit, but obviously this will be guided by your surgeon. I'm talking in general. Then on the next day, we ask you to sit. If sitting is comfortable, then we ask you to go to the toilet and back or walk in the room itself and see how it goes for you. Usually, if there was a radiating pain before the surgery, in most of the cases, the pain is significantly better when you stand and walk. Then after having walked in the room, then on the next day, we ask you to walk outside the room in the corridor. And if you have stairs at home, we also ask you to do stairs. And in general, once you have done the stairs, you are good to go home. The drain and the urine catheter usually comes out on day 2 or day 3, and then you go home. So when you go home, you are able to do most of your activities like going to the kitchen, making yourself a cup of coffee, watching telly, and walking in and around your home. So most of the routine or light activities you are able to do. You come back to us on day 15th or visit your general practitioner on day 15th to examine your wound. If there are sutures to be removed, we take them out on day 14 or day 15. And then you visit back your primary surgeon where we advise you gradually to strengthen your core and back, and we guide you through exercises customized to yourself depending on how you're doing, how is the pain, what kind of surgery was done. And then we advise you some exercises to gain some strength and mobility. So after around 3 months or so, you are able to do pretty much most of your activities and return to your previous level of activity. Depending on what is your profession or what is your job, you might have to rest around 4 weeks to 6 weeks, depending on also what type of surgery was done, what technique was utilized during the surgery, was it open or minimally invasive. All these factors, your surgeon will be in a better position to tell you how long you should rest before you join your occupation or join your profession. And that should be a gradual, phased return, not a perfect full return on the day one. So usually we advise to have a gradual return to your job so that there is a smooth transition and smooth return to your job. So even after now 3 months or so, when you're back to your pretty much what you were before and your baseline activity, there are still some precautions or some advices that we ask you to follow. One of which is when you bend, you have to keep your back straight and not arch your back, which is not itself a precaution. It is just how we all should be doing, how we all should be bending. So that is how we advise you to bend. Otherwise, also what you have to avoid is prolonged sitting. So prolonged sitting is something that can worsen your back pain or cause more problems. If you are having like daily long hours of sitting job, then we advise you to get up frequently, have some frequent breaks after every 45 minutes, 1 hour, and move around a bit before you sit back again. We ask you to avoid twisting or high impact activities. If there is especially spinal fusion done, then we want you to give it some time until the two vertebrae starts fusing. And then once they are fused with regular monitoring of x-rays, then gradually you can also resume twisting activities, but that will be guided by your surgeon. Now, will you have pain after the surgery? Now, this will really depend on what your previous condition was, what your surgeon has told you the likely expectations are after the surgery. If there is a multi-level degenerative problem at all the levels or most of the levels in the back, and you are a smoker, you are not following the advice, or if you are overweight, then likely chances are yes, you are going to have pain even after surgery. But if you're following everything, you are doing exercises well, you are not smoking, you are having good ergonomics, the surgery was done for a clear indication, then yes, you're likely going to have a very good outcomes from the surgery and a pain-free back. Now, if there is pain after surgery, when should you consult the doctor? What kind of pain is a bothering pain and when you should be worried? So one of the things to look at is the pain just at the surgical site or is it going down your legs? If it is going down your legs, then it means that it is a nerve-related pain and it is likely that the nerve is getting pressed. In such situations, if it is not getting better with medicines, it is advisable to meet your surgeon and look for a cause. If it is just dull aching, nagging, non-specific, localized low back pain, then I would not worry much. I would ask you to focus on your exercises, ergonomics, eating well, sleeping well, lifting well, bending well, all of those activities, some hot fermentation, and you might get better. If you still have some problem and not getting better, the pain is worsening, then yes, you have to visit your surgeon who will investigate as to why the pain is worsening. There might be some low-grade infection happening. There might be loosening of the screws. There might be some underlying problem that needs to be addressed. So yes, if the pain is not getting better, you will need to visit your surgeon. But if you have a pain that does not have a cause, it does not really mean that the surgery has failed. It is just sometimes difficult for us to pinpoint the exact cause for the pain after surgery when your MRI, if taken after surgery, shows no obvious cause for it and it is just some pain that we are not able to address. In such situation, we will advise you to optimize your conservative treatment, optimize your ergonomics, optimize your exercises, visit a pain physician. But if you have nerve-related symptoms associated with it, like numbness in your feet or numbness in your affected part of the legs, then this numbness is something that is because of the long-standing compression on the nerves that you had before the surgery. So if there is numbness in the nerves for quite some time before surgery, the likely chances are that the numbness will stay after surgery. So numbness is something that we won't be able to do much about, but nerve-related radiating pain is something that should get better after surgery. And if it's still there after surgery, there is usually a cause for the nerves to be compressed or something similar. If you have had fusion of your spine, most of the times, if it is single level, 2 level, you are able to bend and do pretty much what you were doing before. If it is a long segment fusion, then yes, you are likely to have some stiffness in your back. But with some proper yoga exercises as advised by your physiotherapist and your doctor, you should be able to gain reasonable range of motion. So as such, spine surgery would not limit you if there is a small segment fixation or routine surgery. But yes, if it is an extensive long surgery, then you might have some limitations in the rest of your life, which I think is important to be discussed with your surgeon before the surgery. With that, I would say most of the patients are able to return to their life after spine surgery gradually, and that surgery is a step. It is not end of the treatment. There is a lot after surgery that you need to do from your part as well. Spine surgery can change your life. It is to make your life better. It is not to make your life perfect. But how you live your life after surgery will decide how good or bad this change will be. So yes, you will have to make some changes in your life like sacrificing smoking, reducing your weight, having good core and back or strong core and back, doing exercises regularly and following your surgeon's advice. With that, I hope that this video has given you some valuable insight about what your life will be after spine surgery like and what it will look like for first few weeks or months after spine surgery. If you have any questions, you can write down in the comment section below and we'll be glad to help you as we get time to answer your questions. You can also WhatsApp us on the number given below, but please do not expect free consultation or a free advice. I will not be able to give you that without seeing the patient. You will need to book a proper appointment for an opinion. Thank you so much.